Hi, welcome again to another and the last of a four-part webinar series sponsored in collaboration with the National Consumer Voice and the National Long-Term Care Ombudsman Resource Center. Once again, my name is Dr. Sherry Gibson, licensed psychologist, and I'm really pleased to bring one more training to you. And this training is titled Managing Anxiety and Grief in the Time of COVID-19. I want to start by saying, and just maybe labeling for all of us out there, that the coronavirus has affected us in many different ways. Physically, emotionally, economically, socially, certainly, and psychologically. All of us are dealing with the very real challenges of widespread serious illness and the inabilities of healthcare systems to cope with it. Social and community disruption, economic fallout, and financial problems. All obstacles and interruptions to many aspects of our daily lives. And the list goes on. In addition, the COVID-19 pandemic has resulted in enormous loss of life in the United States and across our globe. The collateral damage at this level of mortality, we could only anticipate, but could never overlook. It is important that the burden of bereavement and its potential mental and physical health consequences is continually factored into discussions of the public health challenge facing not only this nation, but all nations. Since the COVID-19 outbreak, science has been documenting that for some people, as a result of social inequities and how their identities are perceived and treated by society, are more impacted than others. COVID-19 has exposed this nation's long-standing social and political inequities in race, class, gender, national origin, and other factors. And in recent months, we've witnessed an incredible display of hurt and righteous anger expressed by marginalized Black and brown people and entire communities across this country who cannot sit back in the wake of the recent killing of George Floyd and so many more before him. And what does this mean against a backdrop of a global pandemic, where only in these past 6 months, most of this country was quarantined and continues to be quarantined? Although there's been substantial attention given to identifying persons with coronavirus infection, identifying the mental health care needs of people impacted by this pandemic have been relatively neglected. This is surprising given that mass tragedies, particularly ones that involve infectious diseases, often trigger waves of heightened fear and anxiety that are known to cause massive disruptions to the behavior and psychological well-being of many in the population. For example, in a recent large survey of people highly susceptible to the coronavirus infection, specifically Chinese medical workers, the prevalence rate of traumatic stress was at an alarming 73.4%. Depression was at 50.7%, generalized anxiety at 44.7%, and insomnia at 36.1%. Although these findings are quite disturbing, they are not isolated, as research on the psychological impact of previous global disease outbreaks has demonstrated clear links between pandemic-related anxiety and elevated symptoms of stress, anxiety, contamination concerns, health anxiety, post-traumatic stress, and suicidality. The American Psychological Society also conducted a survey and showed that there was significant increase in stress related to the economy and work prior to the pandemic, but certainly had risen significantly during the pandemic. You can see here on the left of your screen that people who were concerned with or experiencing stress with the economy in August of 2019 was at 46%, and that rate increased to 70% during the pandemic. A similar pattern was observed around stress related to work. Thereby, in August a year ago, 64% were endorsing stress related to work. That has risen to 70%. It should also be noted here that work as a category was specific to those who were employed during this survey. In addition, there's been parental stress, additional factors of stress for parents specifically as a result of the coronavirus pandemic. At the top of the list was stress around a family member contracting the disease, followed by the government response to the coronavirus and a disruption in daily life routines, particularly adjusting to those new routines, schooling being at the top of that list as students had to move indoors and back to home for it to be homeschooled. Managing the distance with online learning for children, and also just basic needs, the availability of and the access to food and housing, self-isolation, access to healthcare, and missing out on major milestones. There's also stress related to the government's response to coronavirus. What we found, or what the APA, American Psychological Association, found in this survey is that nearly 7 in 10 Americans, that's 67%, reported that the government response to COVID-19 was a significant source of stress in their life. And as many of you know, now that you're viewing this webinar series, we're well into 6 months and beyond in this virus. This has become more of a chronic state for many of us in our work and in our livelihoods. We also can't ignore what it means to witness mass amounts of death during this time. The context of dying during COVID-19 raises up several concerns. One is the shocking and unanticipated death that has been associated with the disease. Isolation of family from the dying and from supports, people dying alone away from family, and the high anxiety and helplessness that comes out of the fragmentation of caregiving and important attachment bonds. There's also an existential crisis that occurs, and we've been noticing that people often ask the question, where is God now? Persons are now quarantined out of their religious communities and are experiencing those important rituals in isolation. There's also a profound loss of meaning, trying to make meaning of something so tragic and so widespread. There's been a disproportionate loss within minority communities and overwhelmed medical systems that are void of family supporters who play a very key role in care. It's important to note and define what normal grief is. Grief reactions vary depending on who we are, who we lost, our relationship with that person, the circumstances around their passing, and how much their loss affects our day-to-day functioning. Different people may express grief differently. You may even have different grief responses between one loss and another. Reactions to grief and loss include not just emotional symptoms, but also behavioral and physical symptoms. And those reactions often do change over time. All are normal over a short period. Here are some symptoms that are often experienced. On the emotional side, we see shock and denial, a feeling of numbness, deep sadness, anxiety, guilt sometimes, and fear, anger, irritability. Behaviorally, There may be unexpected bouts of crying, changes with sleep, poor appetite, withdrawing from others, restlessness, or trouble making decisions. And on the physical side, we see problems with concentration, exhaustion or fatigue, decreased energy, problems with memory, upset stomach, pain, and headaches. Some abnormal symptoms such as drug use, alcohol abuse, violence, suicidality, all of those types of behaviors do warrant reaching out for professional help. In addition to the normal grief response, there's also a term called prolonged grief. And the ICD-10 lists out some criteria that meets a diagnosis of prolonged grief. And I've listed those criteria here. First and foremost, there is a death of a close person. There's the persistent and pervasive grief response that's accompanied by a longing for and a preoccupation with the deceased. Intense emotional pain such as sadness and guilt, anger, all those things that I described earlier. And this goes on for a minimum of 6 months following the death, exceeding all social, cultural, and religious norms. And finally, and I think the most important piece of this criteria is the significant dysfunction or impairment in the person's personal, familial, social, occupational, and other functioning. Many scholars and practitioners have commented on the public health crisis of grief right now, particularly that we are grieving in isolation. And it's somewhat of an oxymoron, isn't it? Because in many cultures, including our own here in the United States, mourning is a shared social practice. We can anticipate that a spike in COVID-19 related prolonged and complicated grief is a potential public health crisis. And there's an urgency now in the need of timely access to mental health services to address those reactions. This also gives us an opportunity to start thinking creatively about our efforts in attending to the bereaved. We've learned from previous epidemics, particularly Ebola in Congo, where certain rituals can be done in different ways that don't expose people to the disease. Funerals now can be live streamed. In fact, this is a new era of e-mourning. Physicians and chaplains use both speaker and video chat now to allow families to say goodbye to a clinically ill loved one and to deliver last rites. It's an extraordinary time in this high-touch field that we have been drawn into has now become high-tech. So where do we go to next? How do we cope with it ourselves, and how do we help others cope with the anxiety and grief that so many are experiencing? Well, I want to share with you an acronym that has been developed and published by a psychologist, Dr. Russ Harris, who is also author of The Happiness Trap. And he uses tenets of acceptance commitment therapy to draw for us a pathway, if you will, to managing our anxiety. And the acronym that he presents is the acronym of FACE COVID. Here's a quick summary of the key steps, and we'll explore them in more depth. F is focus on what's in your control. A, acknowledge your thoughts and feelings. Come back into your body and engage in what you're doing. And COVID, committed action, opening up, values, identifying resources, and disinfect and distance. So let's dive in. It's all too easy for us to get lost in the worrying and the ruminating about all sorts of things that's out of our control. What might happen in the future, how the virus might affect you and your loved ones, or your community, or the country, or the world, and what will happen tomorrow, and so on and so on. While it's completely natural for us to get lost in such worries, it's also not very useful or helpful. Here and now, the reality is we all have far more control over our behavior than we do over our thoughts and feelings. They come up without our invitation. They'll pop into our heads without knowing. And so our number one aim here is to take control of our behavior, because that is the one thing we can control right here and right now, to respond effectively in a crisis. And this involves both dealing with our inner world and our outer world. Our inner world is all of our difficult thoughts and feelings. But how do we do this? When a big storm blows up, the boat in the harbor drop anchor. Because if the boat doesn't, they'll get swept out to sea. And of course, dropping anchor doesn't make the storm go away, because anchors can't control weather, but it can hold a boat steady in the harbor until the storm passes in its own good time. Similarly, in an ongoing crisis that we find ourselves in now, we're all going to experience emotional storms, unhelpful thoughts spinning in our head, and painful feelings whirling around our body. If we're swept up in that storm inside of us, there's nothing effective we can do. So the first practical step is to drop anchor using this simple formula, the ACE formula. Silently and kindly, you want to acknowledge whatever is showing up inside of you, your thoughts, feelings, emotions, memories, sensations, urges. Take the stance of a curious scientist here, observing what's going on in your inner world. As you do this, often it's helpful to put this into words. Maybe silently say to yourself something like, wow, I'm noticing anxiety here. Or there's grief. Or there's my mind worrying. Or I'm having a feeling of sadness. I'm having thoughts about getting sick. And while continuing to acknowledge those thoughts and feelings, you also want to come back into your body. Now note here, you're not trying to turn away from, escape, avoid, or distract yourself from what's happening in your inner world. The aim is to remain aware of your thoughts and feelings, continue to acknowledge their presence, and connect with your body to actively move it. Why is this so important? It's important so that you can gain as much control as possible over your physical actions, even though you can't control your feelings. Remember, F is to focus on what's in your control. So I've listed here a few ideas for you to play with in ways to attempt to come back into your body. You might slowly push your feet into the floor, or straighten your back up and your spine. If sitting, you can sit upright and forward in your chair. You might want to try pressing your fingertips together, or stretching your arms and neck, shrugging your shoulders, and certainly connecting with your breath. Breathing slowly and methodically can help in so many ways. And while you're doing that, you want to get a sense of where you are and refocus your attention on the activity you're doing. Find your own way of doing this, or try some of these methods. So a couple that I've listed here is you can look around the room and notice 5 things that you can see. Notice 3 or 4 things that you can hear. And then notice 2 or 1 thing that you can feel. And by feel, I don't mean emotionally, I mean by touch, tactile. Just notice where you are in this space and what you're doing right now. Notice the way that your back feels against your chair, or the way that your hand feels with the pen in it. If you're sitting outside, notice how the breeze feels, or the sun, the warmth that you're getting on your face. And you want to end this exercise by giving your full attention back to the task at hand. Dropping anchor is a very useful tool. It's useful for handling those difficult thoughts and feelings and emotions and all those things that just come up out of nowhere. It helps switch off our autopilot and re-engage in our lives. It can help with grounding and steadying yourself in these difficult situations when you're on a hard phone call with a family member or a resident. It disrupts the rumination and the obsessing and the worrying, and it focuses your attention back onto an activity that you're doing. The better you anchor yourself in the here and now, the more control you have over your actions, which makes it easier to do the next steps in the acronym of COVID. Committed action means effective action, guided by your own core values. Action that you take because it's truly important to you. Action that you take even if it brings up difficult thoughts and feelings. Once you've dropped anchor using that ACE approach or the ACE formula, you'll have a lot more control over your actions. So this makes it easier to do the things that truly matter. Now, obviously, that includes all the protective measures against coronavirus, frequent hand washing, social distancing, and so on. But in addition to those fundamental effective action, you might want to consider what kinds of things are you doing during quarantine? If you're spending a lot more time at home because of the quarantine, what are the most effective ways to spend your time? You might want to ask yourself repeatedly during a day, what can I do right now, no matter how small it may be, that improves the life for myself or others that I live with, or people in my community? And whatever the answer is, do it and engage in it fully. I've listed some questions for thoughts for you to explore more. For example, saying something kind to someone who is in distress, in person or a phone call or a text message. Simply saying, I'm checking on you, I want to know how you're doing. Maybe finding out if you can help someone with a task or a chore, to cook a meal or hold someone's hand or play a game with a young child or play a game with an adult. Can you find comfort or provide comfort to soothe someone who is sick? And maybe turning some of that care inward, providing comfort to yourself in whatever form that means to you. Next in the acronym is O for opening up. Opening up means making room for difficult feelings and being kind to yourself. Difficult feelings are guaranteed to keep on showing up as this crisis unfolds. The fear and anxiety, anger, sadness, guilt, loneliness, frustration, and confusion, and so much more. We can't stop them from arising. They're normal reactions, but we can open up and make room for them. Acknowledge that they're normal. Allow them to be there, even though they hurt, and treat ourselves kindly in that process. Remember, self-kindness is essential here, particularly if you want to cope well during a crisis. Ask yourself this: if someone I loved was going through this experience, feeling what I'm feeling right now, if I wanted to be kind and caring towards them, how would I treat that person? How would I behave towards them? What might I say or do? And then try treating yourself the same way. It's so much easier said than done. I get it. But it really is worth exploring and turning that care inward, because so many of you who are watching this webinar have been guided into your profession because you have a lot of empathy. You want to make a difference in a person's life, or maybe you want to make big differences in the world. It's so important that we turn that care inward so that we can make the big difference. V is for values. Committed action should be guided by your core values. Your values might include things like love, respect, humor, patience, courage, maybe honesty, caring, openness, and kindness, numerous other values. Look for ways to sprinkle those values into your day. Let them guide and motivate your committed action. Because one thing we know is that when we act in line with our values, that are consistent with our values, when our behaviors are consistent with our values, we lead more satisfying lives. Some questions that I'd like to pose for you to ask yourselves. What do you want to stand for in the face of this crisis? What sort of person do you want to be as you go through this? When you get to the other side of this crisis, how do you want others to see you? When you look back on yourself and you reflect on your own behaviors and your actions, do you want to feel proud of that? How do you want to treat yourself and others during this time? What can you say and do that will enable you to look back years to come and feel proud about your response? I is to identify resources. Resources for help, assistance, support, and advice. The National Consumer Voice and NORC is an excellent resource. Another important aspect of that process involves finding a reliable and trustworthy source of information for updates and guidelines. I've listed a few here: the World Health Organization, CMS, NORC, but find out who that reliable source is and use that as a guide in terms of resources. And D is simply disinfect and distance physically. We can't say this enough. You want to wash your hands regularly. Practice social distancing as realistically as possible. Physical distancing does not mean cutting off emotionally. And in fact, there's been some interesting commentary from psychologists across this country who initially at the onset of COVID-19 made recommendations that we don't use the term social distancing because it implies that we socially isolate from one another. And really what we should be doing is physical distancing, because you can still be social without being physically close, as we're all learning. These actions are truly caring in nature, because remember, we want to live by the golden rule. So in summary, again and again, as problems pile up in this world around you and emotional storms rage within the world within you, you want to come back to the steps of face COVID. And in fact, you might want to even print this slide for yourself and stick it somewhere where you can remind yourself of this acronym. I've been using it a lot in my private practice, and it really does work well. I want to switch now to say a few words about grieving. It's really normal and important to express your grief and to work through the concerns that arise for you in this time. Avoiding your feelings may not be helpful and may actually delay or prolong your grief. So I've listed here a few suggestions that may help you and those you serve. You want to find supportive people to reach out during your grief. This is the time when support of others may be very helpful. Don't be afraid to tell them how they can best help, even if it means just listening. It's often helpful to talk about your loss with people who will allow you to express your emotions. Take extra care of your health. Often at a time of loss, we stop doing the things that we need for our own health care, such as exercising, eating healthily, taking prescribed medications. If you're on a healthcare regimen, it's important to follow that plan, making adjustments in the context of limited access and physical distancing. Try to postpone any major life changes right now. Give yourself time to adjust to loss before making plans to change a job or move or sell your home, remarry, and so on. Grief can sometimes cloud your judgment and ability to make decisions. You might also consider keeping a journal. It's often very helpful as a way to work through your feelings and to write or tell a story of your loss and what it means to you. And find a way to memorialize those who have died, or maybe the loss of the life that we had. You know, grieving isn't just about death, but it's about non-death things. You may be grieving the loss of finances or insurance benefits. Perhaps your spouse or your partner has lost their job during this quarantine. Perhaps you're grieving the idea that everything has changed in your work. For example, not being able to go into long-term care facilities or not having the resources available to you as you once did. For family members, it can mean that we're grieving the way we connected with our loved ones living in long-term care communities. It might be just grieving what was our normal has now maybe forever changed, or it sometimes can feel that way. I think also for those of you who are working, you can access your employee assistance program benefits. You might also consider joining a grief support group or contacting a grief counselor for additional support and help. There are a lot of virtual groups happening right now, and many faith communities are offering support groups in that way. So reach out to those who specialize in grief so that you can get the care you deserve. I've also listed on here participating in activities, staying active through exercise and enjoying enjoyable activities, outings with supportive others, even at a physical distance. Starting maybe new hobbies. You might remember at the beginning of the pandemic, we saw a spike in puzzles. I even have a puzzle sitting on my kitchen table right now. But those kinds of new hobbies can help you get through the tough times while providing opportunity for constructive development and use of your energy. Loss is multifaceted, and so is grief. There is no one size fits all because my process will be very different from your process and so on. Give yourself and others around you the permission to bereave the loss and hold no expectation for the duration of how it should look and feel. It's going to be very unique and individualized. I also want to leave you with a hopeful image and a message of creativity and resilience. This image was provided by Miss Leslie Carter from Longleaf Assisted Living. And this depicts the way many long-term care communities are being creative in providing a supportive, connecting type of community. Here at Longleaf, they've put up a large glass window partition, decorated it in a way that is joyful and promotes harmony outside while allowing for people to see one another. And I think one thing that I have noticed during this time of working with NORC and the consumer voice is that there is a lot of resiliency among us, not only in our workplaces and among providers and caregivers, but also, more importantly, in residents and families. People are really shoring up and pulling from those deep places within in order to manage this phase, this season that we're in right now. And people are getting creative about how to do that. Remembering that through times of vulnerability, we can also be creative and grow in unique and wonderful ways. So I want to thank you for sharing with me these 4 webinars, for the outreach that I've heard from many of you out across the country. I want to extend my thanks to the National Consumer Voice and to the National Long-Term Care Ombudsman Resource Center. I've included at the end of this webinar resources that will help guide you in getting more information around anxiety and grief. And there are lots of resources through these 2 organizations. You can also find them in social media. Thank you again for your time, and I wish you all the very best. Take care and be well.